Oncologists are sounding the alarm. A common kitchen item may be linked to higher stomach cancer risk. Not exotic or rare, right there on your table, the salt shaker. Today, we unpack what the research says, what it does not, and how to protect yourself without panic. From home cooking to processed foods, sodium sneaks in more than most of us realize. This video is educational, not medical advice. Talk to your clinician for personal guidance. Stomach cancer is often silent early, and outcomes improve with prevention and early action. High-salt diets can irritate the stomach lining and may worsen the impact of H. pylori bacteria. Salt lives in obvious shakers, and inside breads, sauces, meats, and snacks we barely suspect. Let us look at the evidence, risk factors, and practical swaps you can start today. This is not about zero salt, it is about smart sodium choices that still taste great. First, what exactly is stomach cancer, and who is at risk? Then, how salt may play a role, and what changes truly move the needle. Stay with me for practical tips at the end you can use tonight. Stomach cancer, or gastric cancer, begins in the lining of the stomach, most often the glandular cells. Early symptoms can be vague: indigestion, fullness, mild pain, or unexplained fatigue. Risk increases with age, certain regions, family history, smoking, alcohol, and H. pylori infection. H. pylori can inflame the stomach, and chronic inflammation can raise cancer risk over time. High salt may damage the protective mucus layer, making the lining more vulnerable to injury. Some studies associate high salt diets and salt-preserved foods with increased gastric cancer risk. This is correlation, not certainty, but the pattern appears consistently across populations. Salt itself is essential for life. The issue is excessive intake, especially from processed foods. Moderation helps the heart and may benefit the stomach without sacrificing flavor. Small, steady changes at home add up, and they are practical for the whole family. Next, let us unpack where the salt is really coming from and what to switch today. Spoiler, the shaker is just the start. Packaged foods often carry the bigger load. Top sources include breads, processed meats, cheese, canned soups, sauces, and restaurant meals. Read the label, check sodium per serving and the serving size. It is easy to double up. Choose reduced sodium versions of soy sauce, broths, and condiments when available. Snack foods and instant meals can pack a day's worth of sodium in one sitting. 1 teaspoon of salt is about 2,300 milligrams of sodium, the upper daily limit for many adults. Many benefit from less, but needs vary. Consult your clinician for personal recommendations. Restaurant and takeout meals are frequent sodium bombs. Split portions or ask for sauces on the side. Lowering sodium may reduce irritation and help limit factors that contribute to gastric risk. Flavor builders like herbs, spices, garlic, and citrus help you use less salt without bland meals. Taste buds adapt in weeks. Step down gradually and you will notice the difference. 2 simple rules: taste before you salt, and check labels on staples you buy often. Next, what does the evidence actually show, and what are its limits? Populations with high salt-preserved foods often show higher gastric cancer rates. Large cohort and case control studies link high sodium with increased stomach cancer risk. Mechanisms include mucosal damage and synergy with H. pylori-related inflammation. Association is not causation. Diet patterns, smoking, alcohol, and infection status also matter. Still, multiple analyses converge. Less salt and fewer salt-preserved foods is a prudent step. Very hot drinks are linked more with esophageal, not stomach, cancer. Keep risks straight. Oncologists often emphasize moderation. Reduce processed, salt-preserved foods. Treat salt as a tool. Dietitians can tailor targets if you have hypertension, kidney, or gastric concerns. Swap. Do not suffer. Your pantry can evolve over a few shopping trips. Next up, simple swaps and cooking strategies that cut sodium fast. Let us get practical with week 1 changes that add up. We will start at the store, then move to your kitchen. Compare brands, choose sauces, broths, and beans labeled reduced sodium or no salt added. Buy basics plain, season at home so you control the total salt. Limit processed meats, pick rotisserie without brine, or roast a batch at home. Build base flavor with aromatics. Deep flavor means you can salt less. Acid brightens taste. A squeeze of citrus boosts perceived saltiness. Toast spices to unlock aroma, then finish with a modest pinch of salt. Season in stages. Taste, adjust and stop when it is just right. Ask for sauces on the side. Dip, do not drench. Balance salty items with fresh sides, greens, citrus, plain rice, steamed veg. Split salted mains and add a salad. Simple portion control reduces total sodium. Skip salting at the table for a month. Let your palate recalibrate naturally. Keep your favorite meals. Just remake them with smarter seasoning and fresh textures. Do you need zero salt? No, your body needs sodium. The goal is avoiding excess. Sea salt versus table salt. Both are mostly sodium chloride. Moderation matters more than type. Iodized salt helps prevent deficiency. You can get iodine from foods too. Ask your clinician. Lower sodium benefits blood pressure and heart health, a win beyond the stomach. Many foods taste mild but hide sodium. Bread, cereals, sauces, always check the label. Try a 3-week ramp. Read labels, swap high-sodium staples, then rebuild flavor with herbs. If you have chronic stomach issues, ask about H. pylori testing and evidence-based treatment. Plan basics, low-sodium broth, beans, tomatoes, herbs, citrus, garlic, and whole grains. The salt shaker is not the villain, it is a reminder to be intentional, not excessive. Small changes today can lower long-term risk while keeping meals joyful. For personal advice or symptoms, speak with a qualified healthcare professional. If this helped, subscribe for more evidence-informed health and cooking guides.